functional neurosurgery for movement disorder has a long tradition and indeed started with lesioning the brain. So back in the days, neurosurgeons used to do lesions using radiofrequency. Then DBS came, and for most part, this type of techniques were abandoned, even though there's still a role for their use. And in more recent years, there's been an interest in using less invasive ways to perform lesions in the brain. Gamma knife was developed a while back, and there have been some studies using it for movement disorders. But for sure, when you ask me about what's new in this space, I need to mention MRI-guided focused ultrasound, which is the newest way to perform lesions in the brain without opening the skull, the skin. So we call it incisionless, meaning that it's still a brain operation, it's still a procedure done to the brain to create indeed a lesion in the brain, but there is no opening, and therefore patients' acceptance is much higher than what we see with other techniques where we need to go through the skin and the skull and the brain to obtain the effect we want to obtain in movement disorders. So focused ultrasound has been directed towards classical targets of functional neurosurgery, like the VIM in the thalamus to treat tremor. And that's approved by the FDA and other agencies for essential tremor, with also the possibility of doing a staged bilateral procedure, so meaning that after 6-9 months, the patient can receive the same treatment on the other side of the brain. Then other targets approved for this condition are the pallidum, unilateral pallidotomy for Parkinson's disease, and more recently the PTT. PTT stands for pallidothalamic tract, is a bundle of fibers in the one matter between the thalamus and the posterior area behind the subthalamus, and lesioning this part of the brain mimics the same effect of lesioning the pallidum to some extent, and that's also approved for staged bilateral, again for Parkinson's disease. Also for Parkinson's disease, there is thalamotomy, again VIM, approved for tremor related to Parkinson's disease, although my prediction is that now that PTT lesioning is approved, most people with Parkinson's, even with tremor only coming from Parkinson, will receive PTT lesioning, unilateral staged bilateral, like I said. So this is an interesting avenue because it's bringing more people to functional neurosurgery. More patients out there are aware also deep brain stimulation. In the past, people didn't necessarily know about it, and now that they hear about focused ultrasound and they come to our clinic, they are informed about the other ways we have to target their brain. And as a result, yes, we're doing more focused ultrasound, more people are getting functional neurosurgery, but also more DBS has been proposed and done because of the renewed interest in functional neurosurgery.